I am Dr. Philip Macmillan, and today I want to share with you something that seems to be causing quite a lot of discussion on the internet and mainstream media about Switzerland stopping COVID 19 vaccination. And you have two sides as usual. You have people on one side saying that it's because of vaccine risks, and the other side saying, no, this is just because the campaign was so effective. This is why it was stopped. Well, what really is the truth? What are the facts about this case? That's primarily what I'm curious about, and that curiosity causes me then to try and look at the facts. So let's get into a few of the facts that I think are relevant. So the first question is it actually true that Switzerland has stopped their COVID vaccine campaign? Is that true? Well, what I then did is that I went to this site here, the Federal Office of Public Health, Switzerland, and there, in very clear writing, it says, in principle, no COVID vaccination is recommended for spring or summer 2023. People at especially high risk can receive a vaccination following an individual consultation with their doctor. Well, isn't that interesting? Why would people not have gotten that consultation in the first place? Why is that consultation now relevant? That would be one of the first places to start. But the truth is, they have very clearly said they are no longer recommending it for the general public. Your doctor has to recommend it. And more specifically, what does that mean in terms of what your doctor has to recommend? So, as I said, it's not recommended for people at it's only recommended for people at especially high risk to receive a COVID 19 vaccination. The high risk they consider people over the age of 65, people age 16 or over with a chronic condition, and people 16 over with Down syndrome. And they have here pregnant women. Very interesting. And pregnant women, they are very specific that they only want the mRNA vaccine to be delivered. Raises a point that I did earlier with regards to the concept of targeted vaccination. I'd always said this from the very start of the pandemic. We knew who was high risk. Why would you then expose the public to a novel technology when you don't have long-term safety data, especially when you know 97% of the people have at least one comorbidity? And that's technically what they have said here. They are interested in the people 16 or over with chronic conditions and older. That's exactly who the research pointed out was at significant risk. Now, why would they have done it at this point in Switzerland? What is it that is happening? Well, their explanation is quite simple. What they have said here is that around 97% of the Swiss population of 8.7 million have developed antibodies against the virus via vaccination or infection. So one or the other, vaccination or infection. And this was just updated just on the 6th of April, 2023. So this information and this link is also there if you want to go and look at it yourself. So they have that 97% of the population has antibodies against COVID-19, either vaccine or infection. The question is, what percentage of the population is actually vaccinated? And again, me being curious, that's what I was interested in. And here we have it. And this lovely company, Y Charts, has clearly showed that since about January 2022, the Swiss have stopped being vaccinated. It largely has stayed at between 66 and 69% of the population over that time. So what it means is about 31% of the population in Switzerland remains unvaccinated. That's interesting as well. Are they saying now that immunity, natural immunity, is effective against COVID-19? Where would we get that from? As far as we were told, if you even had COVID-19, you were encouraged to still have the vaccine to create hybrid immunity. Now, I'd always argued that that didn't make scientific sense, but just the same, let's reiterate what it is about the basics of the science. Here we have typical coronavirus. And what you can then see with this typical coronavirus is that it has on the surface all these spike proteins. Now, what I want you to notice is that in this image here, this is a cut section through the virus. And what it's showing us is that in blue here, that's the spike protein. But guess what? The virus has multiple other important proteins that the immune system reacts against. There's the nucleocapsid protein, N protein here. There's a membrane protein here. There's an envelope protein here. And there's an RNA viral genome protein in here. So in the context of the two ideas of hybrid and natural immunity, they're slightly different. Because in the context of natural immunity, what would happen is that the body would produce a very broad antibody profile against all of these critical antigens: spike, nucleocapsid, membrane, enveloped, RNA viral genome. That's what natural immunity would do. On the contrary, when we look at the vaccine, it primarily does immunity against just the spike protein. And based on the evidence that had been coming out previously in the year, it seems to suggest that even in those who had natural infection before, the vaccine can direct their immune response to primarily do a spike response to the original variant of the virus. That's the difference between natural immunity and hybrid immunity. So what it means in Switzerland is that 31% has natural immunity and 69% has hybrid immunity, because I don't think anyone left at the moment hasn't been exposed. Even the ones who had the 3% who didn't have antibodies, it probably means that they have very good mucosal immunity. What that means is that the virus can't penetrate their mucosal barrier, and therefore they wouldn't have antibodies in the bloodstream. But everybody would have been exposed. So, could there be any other reason why Switzerland would do this at this point? What else could be happening? Now, you have to remember that Switzerland was extremely strong in their position with regards to the need for vaccination. And here you have this here. This is looking at Swiss commandos losing a court fight over COVID-19 jabs. And at that point, these 4 members of the special forces, this was in 2021, who refused to be vaccinated, lost their bid, and they therefore lost their job. And so in reality, Switzerland had taken a pretty strong position on this. Why would they change their angles at this point? What would be potentially one of the reasons why they would change around their position? Well, as fate would have it, I had an interesting article, because in Switzerland, they're one of the few countries in the world that are having to face a court fight with regards to what is going on in terms of their battle with the mainstream, or the people who are against what was done with the vaccine mandates. Here you have, this is the Conservative Woman, this article here. Will Swiss court action over vaccine injuries turn the worldwide tide? This was done in December 2022. And in effect, in it, criminal charges have been filed against the Swiss Drugs Authority on behalf of 6 people allegedly injured by the COVID vaccination. They have a team of lawyers and scientists who have compiled comprehensive evidence report of over 1,200 items of evidence, arguing that they created a risk to public health, which significantly exceeds that of SARS-CoV-2. Really, really interesting. Is this what is to come in the future? Really important question. Because if you can't have it both ways, either the vaccine was absolutely necessary, which is why you mandated it, then how can you say it's not needed at this point? That's one of the challenges that public health is going to have to figure out how to explain to the general public, especially if we find that people have been injured. That's one of the big ones. That is where it is that people are likely to get extremely upset. If it turns out that in reality, and when we look back at the people who are at high risk, here you have it in very clear: over 65, over 16 with a chronic condition, over 16 with Down syndrome. They've put pregnant women here, and that really has always been known from the start of the pandemic. As to what reason there was for justification to put it to the not just roll it out to the general public, but to mandate it to the general public, that's going to be a challenge for years to come. And I think that it seems that this pressure has come to bear on Switzerland. We can't know for certain what the reason was behind it, but certainly at this point, the facts are that Switzerland has stopped the COVID vaccine. If you want to get it in Switzerland and you don't have one of those high risk conditions, you have to pay for it. Not mandated, you have to pay for it. So this is quite a change from the original position, and one that I think is quite relevant for the future of many other countries. So I hope you found this information valuable. Look forward to sharing more stuff with you in the near future. And please keep making comments. I always try and see what I can do to answer them. Have a great evening.